Welcome back, Buckeye Nation, to your Caribou Data Science channel. Today is what is today? Today is Monday, September the 6th. It's of course Labor Day here in Central Ohio, or Labor Day in the U.S. And also, first of all, a big shout out to the 7 people from Ohio who watched this video yesterday. Of course, now I need you to step up to the plate today and share this video with your friends and family. You can share it on Facebook, on Twitter. You can, of course, copy and paste the link to this video into an email or a text message. Email or text. Okay, good. I wanted to make sure that was working okay. Okay. Let's see something here. Of course, we always need to remind ourselves that in February of 2021, the governor's office came out and said that the undercounted deaths were close to 4,000 for the fourth quarter of 2020. And rather than going back in and adjusting those numbers and fixing the error, they simply took the missing deaths and added them on to February 11th, 12th, and 13th. And that's what those 3 numbers look like here. Okay, I don't know, my guess is that, the trend, the short trend here would probably been correct. You probably would have saw, you know, you know, this basic pattern here, with February 12th going up and then coming back down a little bit. So that's probably is true. But what we did is, what I'm doing is I'm replacing these 3 numbers with the average number of COVID-19 deaths for those 3 days. And that's what those 3 numbers look like. And look how it changes this plot all of a sudden. Okay? Look how it changes this plot. So this is some cumulative, this is some descriptive statistics. You could say that, well, so the interquartile range is the first quarter is the third quartile minus the first quartile. So that means for deaths, the interquartile range is 47. Okay, with a maximum and also a bunch of zeros in there. Okay, and this is what those numbers look like. The red line is a 7-day moving average. Okay, the blue line is a linear regression line, simple linear regression line. So what you can see here is back in December, first part of December, we begin to see a decline in COVID-19 deaths all the way down to the first part of July. And now we're seeing an increase in COVID-19 deaths in the state of Ohio. Now, there's something we always need to remind ourselves of about the COVID-19 vaccine. Actually, 2 things. One, it will not keep you from getting COVID-19. It may reduce the severity of the disease, but it will not keep you from getting it. And two, it will not keep you from dying. It's going to reduce the chances that you will die, but there's no guarantee that you won't die. Okay. But the question is, should you get vaccinated? Hey, if you're over the age of 65, like me, absolutely. You want to reduce the chances you want to reduce the effects of COVID-19, the chances of death, as much as you possibly can. Okay. You should get the vaccine, if no other reason, to reduce the severity of the disease and also to reduce the chances that you'll die. Okay. But also, don't be misled by cases, as you'll see here. Let's see, interquartile range here. So what's the interquartile range for cases? Two, four, five, eight minus. So the interquartile range is 1,879. Again, this is misleading because this includes those. Well, this is cases, so there shouldn't be a problem with cases. Okay. So what's the significance of the interquartile range? Let's ask a question over here on statistics. So this is an interesting question. Okay, we got an interquartile range. Now what? Interquartile range.
Here's a summary from Khan Academy. The IQR describes the middle 50% of values when ordered from lowest to highest. To find the interquartile range, first find the median of the lower and upper half of the data. The IQR is the difference between Q3 and Q1.
Okay. I just closed R for some reason or other. And we were looking at the state of Ohio. So we're back to cases again. We've already looked at deaths, right? Cases. Look at this huge spike in cases in Ohio. But it's not only Ohio, it's the US, it's Israel, and it's Sweden in cases. Why are these, again, how many of these people were vaccinated? Hmm? Why are we seeing this despite, of course, the media is blaming it on the states that aren't doing it, blaming it on the unvaccinated states. They're basing it on the states that didn't have any lockdowns. The question is, how many of these people were vaccinated? That's the question that really needs to be asked and answered at this point for the state of Ohio, for the U.S., and even and for the U.S. also, as well as Sweden and Israel. Okay, why are we seeing an increase in cases for aggressively vaccinating our citizens? Okay, anyway, state of Ohio, Buckeye Nation, thanks so much for stopping by today. Hey, and don't forget to click on that subscribe button if you haven't done so already. Don't forget to click on the like button. You're very important. We should have one like for every view. Third, click on that subscribe button. Click on the share button. Share this video on Facebook and Twitter today, Ohio. Thanks so much. We'll catch you tomorrow with an updated report.